Now we're scanning the right testis. Here we see the scrotal skin, which is thickened and shows heterogeneous texture due to inflammation. And this is right testis, which shows heterogeneous texture and echogenic multiple scattered microcalcifications. The size of testis appears to be normal. Now we will measure the size of testis. The approximate size of testis is 32.5 into 24 millimeter. Now on color Doppler we will examine the blood flow in the testis. Here we see no flow present in the testis. Minimal peripheral flow present. Here we see the flow is increased in the spermatic cord, which is dilated and echogenic. Minimal flow is also present in the epididymis. But the spermatic cord is increased in size and shows heterogeneous texture due to inflammation and shows increased flow. No free fluid seen in the right scrotal sac. Now we're scanning the left testis. The left testis shows normal homogeneous texture and appears to be normal in size. Here we see the epididymis, which is also shows normal texture. No free fluid present. Now how we will write report.